Mr. Vaibhav Ram, CEO, ZV Global LLP. Mr. Ram, please.
Hi everyone. I hope I'm audible till the end. Yes? The people over there in the back, am I audible? Okay, so we have got a lot of information, we have got a lot of sessions and brilliant hospitals showcasing. So let's take a moment and stop. Let's take a moment and stop because what I'm going to tell right now might actually blow everything up to another level. So let's take a moment and let's stop. Let's see that we are having key decision makers, policy makers, and also a lot of great hospitals that have been serving our country for some time. So let's take a pause. So let me just ask you one question. How many of you know that from how many years is healthcare actually there? Maybe 100 years, 200 years, even more, since when a human knew that you can treat the other person around you, we always had healthcare. But how many of you know that compassion in healthcare actually was born from this soil that we all are here? The state of West Bengal actually had showed that compassion in healthcare is something that's very evident. This is where crores of people were treated irrespective of their financial, caste, race, religion, etc., and given quality of care when it was needed. This was the place where no person ever had visited and gone back with the disease still persisting with them. So it's great to be here. It's my first time in Kolkata and I have yet a lot to explore, but let's dive into the topic that I'm here to discuss. Medicine has been stressed and stretched extremely to an extent that medical professionals and hospitals are the ones that are being burdened with. A lot of data that is there globally, a lot of data that is there in India is fragmented. Data is in the form of papers. Data is in the form of, maybe just a handwritten note. Data is in the form of knowledge that a patient has or the knowledge that a nurse has. Systems are divided. If one person in one place has to get 3 different things done, there is nothing that is connecting. A doctor is having to run through endless paper trials. A team and a hospital is having to maintain endless paper trials in order to get something right. But when anything goes wrong, where does a patient go and blame? The doctor doesn't know enough or the hospital doesn't know to manage. But when we actually look into this is not a healthcare problem. This is a socio-economic problem. We are having hospitals across the tiers. We are having patients across the tiers. We are having different languages, different races, different castes, different religions, different biological structures, different way that we talk. And in fact, Sir from Aster had very clearly mentioned this is a very big problem. But when an issue comes up, who is at fault? A doctor doesn't know how to do the treatment or the hospital doesn't know how to manage. So that's why I was here to break that myth. I remember about a very long time back, maybe I was studying 9th class back then and I didn't know how to even spell some things very clearly. I was in the United States for a conference where, they had taken us there and I met this very keen and very, very unrested person over there. And I got to know that he was setting up a company. All of them were betting on that company. It was going to be big. I had a chance to talk to him and I asked him that, how do you see the future of technology that's there? He said, Vaibhav, the future of technology can never be replacement but assistive. You would not want a technology to come and do your job where you sit and wash your dishes and clothes at home. Rather, you would want it to wash clothes and dishes at your home where you are sitting and doing your job. That's how the technology movement needs to happen. Then I was very surprised at the take that he had, and I was actually hearing a lot of things about him that he is very, very ruthless in the way that he executes. And I came back to India, I didn't know who he was even then, and he did introduce me himself, and about 5 years later the whole world got to know who was he. So I'm actually talking about the chief executive officer of Tesla, Elon Musk. I had met him back in the day when people didn't know him. He was a guy from PayPal who sold the company and got some money and is investing all the company and he himself is homeless. And soon after that, I started my journey on trying to learn more things. And once I got into my engineering, I got a clear vision what I wanted to do. Then I started pushing it further. I worked with John Hopkins, one of the best in medical sciences. I worked with University of Singapore. I worked with a bunch of guys from China and a bunch of guys from Iran. And then I started realizing how bad the healthcare gaps were there in India that none of us actually realized. That's when I got to know the main issues that we had. First, in India, for every one doctor, there are about 1456 patients. That's like 456 patients more than WHO's standard guidelines calling it a stress. More than 80% of medical professionals are overworking for more than 70% of their work hours. I remember meeting a doctor who just finished like a 48-hour shift and she's not having the strength to even move her hands and legs, yet she's sitting on the clinical table to make the decisions that are needed. She's getting it right, but what about her? How much stressed is she? How much pressure is she put on? Then I have realized that in tier 2 and tier 3 towns, the situation is even more worse. You may be having one doctor for every 10,000 patients that are there. That's why there is a lot of pressure on some main medical facilities that are there. And that's when I had thought that what is the thing that a doctor wants? What is the thing that a hospital wants? First, something that can assist them in their day-to-day tasks. That's clinical understanding and giving them the intelligence that is needed. Second, something that was governed, that was responsible, and that gave the output that a doctor wants. Third, something that was interoperable, can be integrated anywhere, can be used anywhere, right from a mobile phone on the go for a doctor to being in the systems. Again, something that is clinically aware and suggestive, something that is governed and responsible, something that is very interoperable. That's governance, that's clinical use, and that's responsibility and interoperability. That is when we have built something called as Meddollina. It is one of India's first and one of very few in the world that is a clinical intelligence infrastructure application that sails with hospitals and medical professionals, helps them take decisive answers and decisive things in their clinical workflows. A lot of clinical terms, I know. Right from diagnosis, prognosis, treatment planning, surgical construct, clinical trials, simulating a particular case, and also helping all the doctors in a hospital know what is happening with that patient at just the tip of your finger. So me and my team had been discussing for a while now, and we were thinking we are going to West Bengal and we are, addressing a crowd that's in the medical fraternity, and we were thinking so hard, what should we do so that all of you will actually know what we are doing, and also finally you get that sigh of relief that fine, now we have someone who is actually solving something and not just building another software to integrate into my workflow and telling my doctor that, hey, you have 48 hours of training or maybe 3 sessions and 3 weeks of training, and now the hospital spending money on that doctor's training and the doctor getting frustrated and the hospital's getting frustrated that how many tools am I having to stack up so that I can finally be independent of these software providers that are there around. So my friend and colleague Samudra, he had brought up an idea. He told Vaibhav, let's stop the talking and let's just show it to them, how it works, and then you explain it to them how it works, so that things get easy. So that's the reason, maybe you can cue the video. Let me have you see Meddollina yourself. Yes, I think we can start. Meddollina, one of India's first clinical contextual intelligence. This is exactly how it looks. It does diagnosis, prognosis, treatment planning, surgical planning, simulations. You can try experimental therapies on chronic illness patients and also see how the probability of that patient being right will happen. We are not a research-based tool, we are solid evidence-based tool. every single answer that we provide is going to be with the evidence from where the data was collected, not 100%, 1000% transparency for every doctor. We have got capabilities to be able to remember, to be able to summarize, to be able to create reports that are needed and get it attested with a doctor. We personally feel healthcare without human touch is not healthcare. I myself go to hospital, even before I get a medicine, looking at the doctor, I am 80% treated. So how it works? There are three main modes that Meddollina works. One is emergency and fast mode, one is deep clinical analysis, and the other is the autonomous mode. That's basically, it decides whether you need deep insights in this or whether you need direct answers to get the things done. When a patient visits a doctor, either the doctor enters it in a text or he ons the voice module that is there and the communication happens. A typical AI scribe that every company does. The moment that happens, the AI picks up the cues, understands what's there, gives the chief clinical complaint along with the differentials that are there and the tests are needed in the SOP standard that a hospital prescribes and gives the output. When this output comes out, you get every single thing that is needed to be considered by a doctor, and now doctor is already 50% free. He already has every single thing that he needs to know, and now he can take the decisions forward. He understands that there might be some escalation triggers, there might be some allergics, like major allergy that 90% of the population in the allergic segment is penicillin allergy. They are allergic to penicillin related medicines. Then what happens? Now a doctor can further cue it, or maybe further talk to Meddollina and say, I have this patient, what am I supposed to do? Because he has taken these particular medications and I think these are the allergies that can be there. And what is needed? Now Meddollina picks up the patient history. For enterprise, this comes from the HMIS, and for individual doctors and clinics, this comes from the previous patient consults. You don't have any dashboards that you're going to click and you're going to see, but you're going to have straightforward answers from the history that is needed to be correlated. Every single thing that you need from a monitoring plan, an escalation trigger, a specific clinical symptom that is needed, along with the medicinal dosages that might have gone wrong to alert a doctor to bring him back to the path. And every single thing has evidence, as you can see in the bottom. It has links where you can click and go and see from where this particular evidence was created. So now a doctor knows that yes, Meddollina is telling me the right answer irrespective of what I'm going to give. And one more very interesting capability that I would want to very clearly tell is that this is an AI that knows when to keep its mouth shut. It is not going to blab, it is not going to assume, it is not going to just hallucinate and think new things that was not provided to it. If it doesn't have sufficient amount of information, it's going to stop. And it will prompt the doctor, I know that you're dealing with a case, but I don't know what further is there in this, so could you help me with that? It also has got a very keen ability to read scans readily. MRIs, CTs, ultrasounds, X-rays, in the chronic illness case, to be able to give the output. It's very simple. Take a photo from your phone or upload a DICOM from your HMIS or directly pull the data from your PACS system and you get the report that's generated out there. What the particular disease is, what the isolation is, where it is, how bad it is, and it gives the output. Yes, there are a lot of providers, Vaibhav, that give me radiological reports, but has any provider ever historically correlated with that particular patient case and given you the output that is needed? No. You get reports from 10 different pays, and now this is when a doctor has to put a lot of clinical thinking into. The moment a report is put, the moment a report is generated, you get an output along with the clinical correlations that are needed for that particular patient. Hey Vaibhav, 6 months back, this patient has come with an symptom that he fell unconscious one day and he had vertigos. 6 months later, I'm able to see that the scan is having some abnormalities. What can this be? Signs of early stage of dementia or Parkinson's, or the person is having any other symptom that is needed with respect to seizures or anything else as such. And it keeps tracking. In women care, there is a capability that is women below the age of 40 years getting diagnosed with breast cancer is the most hardest medical case that you can deal with, because you're not allowed to do mammography. You're just allowed to do ultrasounds, and if that evolves, that's when biopsies. That's why more than 60% of women cases in women care are missed. Now what we say, if that person has visited us continuously, the AI understands it and then does a correlation and predicts. Maybe in the next 2 years, based on the evidence, there are chances of her to develop this. So maybe some lifestyle changes is what we need to get the output that is right. We have got a very, very interesting feature, and that's called the intent bar. As you can see over here, the intent bar is to give a doctor a context of that case on what particular department are we dealing with, what urgency level are we dealing with, and what is the summarization of the case that is happening throughout. So that when you enter a chat, you don't need to scroll to the top and then read the whole chat till the bottom and see what's there. And the same thing gets upgraded in HMIS too. Automatically the intent with ICD, SONMET and coding, it gets pushed into the HMIS where a doctor can be seen. Alongside that, when I say simulations, you might be like, Vaibhav, what do you mean by simulation? I have a patient with 75 years old who is diagnosed with lung cancer, but I'm able to see, further progression which is very aggressive, and I'm not able to see that the chemotherapy is working anymore. What can I do? Then the AI brings in all the cases that we have from our database with the particular treatment plans that were done and then shows it to a doctor. And it says, if you're okay, let me just run a simulation through all the medical parameters are there and give you an output what might work, as chemotherapy is not working. Now, a doctor can get every single thing that he wants to try that particular treatment on that patient. And as you can see over here, you can always back your chats, you can always back up the clinical information, you can generate customizable reports, and you can also go to such extent of saying, hey, I have a patient, he's going through dialysis. I have put the drip rate to this particular, maybe grams per second or milliliters per second. Now, can you monitor what can happen further? And we say, okay, maybe these are the iterations you're supposed to do to get things out. Alongside that, we have something very, very interesting. That is, when we go to an enterprise stage, we directly become the UI on top of their HMIS. That basically means you don't have 10 softwares to deal with, you have one place where everything gets dealt. And that is a place where you can just chat and communicate with the HMIS to pull the data, to push the data, to summarize the data, to code the data. And also, if that patient is referred to another hospital, you can also share that data with patient and doctor consent to that other hospital, where you get readily medical records with the history for that particular patient. We integrate with Ayushman Bharat very easily. We have our own universal healthcare interface so that if a person even goes to international borders, it follows HIPAA compliance and you can always track the case what is happening with patient consent. Now when I said that Meddollina has memory, how does it work? You're just normally dealing with a case and suddenly Meddollina remembers this patient has visited previously. And it identifies the intricacies. Maybe there might be 5 patients with the same details. Then it starts to ask the doctor, is this the patient you're talking about? Has he visited before? I can see very clearly he has visited before. And once that is cleared, you get the dashboard on the side. Every single chief clinical complaint of that patient, along with the medications that were given. And if it is the same disease, it can even show the progression graph of how the disease is progressing, along with the number of reports that we have generated, number of scans that were done, and the analysis that were completed. When this comes to tier 2 and tier 3, this becomes the HMIS for that small clinic that has got no digital data backing. And it's getting operated from the phone or from a normal laptop where internet works. And in the next 6 months, my colleague Samudra is already on the way to make this offline. You can get this into emergency units in tribal areas. You can get this into many, many units across the globe which don't have internet connectivity. I personally am a very big believer of sustainable healthcare, equitable healthcare, and long-lasting healthcare. So every single report that we generate and every single medical query that we deal with, we show that you have saved this much amount of energy, this much amount of data, this much amount of carbon footprint, this is the number of carbon credits you have saved from buying, and this is the amount of hours that you have saved from getting this through. When we went with this particular proposal to the government of Telangana, they were very, very amazed with this, and we have started working with them. We are currently working with Indian School of Business, BCG, and the government of Telangana to deploy this solution across the state, to show that what a state with AI can actually do. We don't want autonomous, we want augmentation. So that's why I personally believe we say Meddollina makes medicine limitless. Meddollina makes hospitals limitless, where we say medicine to infinity. So maybe you'll be like, Vaibhav, we would want to hear a case. So let me put that forward. There was a woman who was 65 years old, suffering from symptoms like swollen face, lack of appetite, gaining a lot of weight, night sweats and all of this. If a typical medical professional sees, the first symptom starts up with chronic care, maybe oncology related symptoms, because all of these match, all of these tick the box. 7 months of her running around different medical hospitals and medical professionals and clinics, and everyone says that, some of them say this is, something related to blood cancer. Some of them say, this is maybe sickle cell anemia, because her body is continuously swelling and tenderness, and etc. 6 months, I'm quoting the term, 6 months of running around. And she met me in Hyderabad, and I told, why don't you go to this clinic that deals with us? Because I can't make any clinical judgments. She goes over there, 35 minutes down the lane, we get to know she is having an immunosuppressive disease called Behçet's disease. Why? Because one particular medical facility forgot to consider the parameters for immunosuppressive disease. This was not an error. This was something that was not being able to catch because of the pressure that they were put into. In similar, there was a 10-year-old child who was basically suffering from symptoms of, continuous stomach pain, indigestion. She was suffering from symptoms of continuous cough, fever, etc. Now the analysis had started from, things like, okay, is this something related to gastro? Is this something related to this? And the differentials were happening. I met her in a medical camp in Andhra Pradesh, where I had told her to refer to one of the medical facilities we have. And you know what was it? It was a genetic issue. Every second generation daughter that they gave birth to had this issue, because of which this was getting triggered. It was a pure genetic issue. It was not a disease, but it was the way that their genotypes were designed throughout the generations. So things like these will come into scope for medical professionals way easily than them having a team and things working. Now maybe because we have a lot of healthcare operators, let's talk in terms of ROIs. Let's talk in terms of how the healthcare output is going to be. Double down in capex, lesser opex, faster operational speed, lesser amount of time to deal with a patient, higher amount of time to get the clinical judgments, reduce in the number of ground staff who are just there to write down or print things or get a stamp done, increase in the number of doctor working hours with efficiency, and increase in the number of appointments that a doctor can take. I know a lot of doctors are going to look at me telling that, Vaibhav, we are thinking to reduce the number of appointments. No, you are definitely thinking to reduce the burden that you have got and the pressure that you are having to deal with. But you being a medical professional, your main motto to get into this thing was to help more and more people, and we are here to help you in that. When it comes to an individual practitioner, what is it? Vaibhav, what is it that we are going to deal with? I would very particularly say, you are having the power from a tier 3 medical facility to a tier 1 multi-speciality hospital to give the equity of care or the equity of intelligence that you can find in Mayo Clinic in the United States, because they call it the golden benchmark. And that's a promise that we always keep. We have data of more than 1.5 million cases across the globe. So that's why when Sir brought in ethnicity and race, We have data from US, we have data from London, we have data from Africa, we have data from Singapore, and we have data from India. And the AI is so unbiased that 0.5% and less than that is the biasness ratio that we have got on testing on these many patients. And on top of that, hallucination is something that everyone is scared of. Hallucination is something that everyone gets pissed off. What if I say we have treated or we have analyzed more than 15,000 plus cases and the hallucination percentage was less than 0.3? Why? Because it's heavily guardrailed. It's heavily decisive that if you don't know, just keep your mouth shut. You don't need to give the answers to a doctor because he's already frustrated in the answers that you're giving. We are DPDP adherent because the compliance is going to start from 2026. We have got HIPAA, we have got SOC 2, we have even got CIDESCO, the medical device license. 90% of India doesn't know that digital infrastructure that intervenes into a doctor's decision needs software as a medical device certifications. We are ahead of that curve too. And the main reason why we have come to West Bengal is because of the amount of affection that we have got from BCCI and especially Sarvani and team, the way they have encouraged us. And also it is the birthplace of my colleague and the head of artificial intelligence, Samudra. And he has continuously told me that Vaibhav, let's go to West Bengal. There is brilliant infrastructure, but there are a lot more people to treat. And that's why we are here. And we officially start our operations in the West Bengal segment 2, where our software will be released for medical professionals to use. And we have already got more than 1,000 plus medical professionals across the globe who want the access for the software. And now when I say access, you might think, Vaibhav, is this a pre-launch event? No. We just don't give the software to anyone and anywhere. Because we want people who actually know how things work, who actually are already adherent to things that are going on, and hospitals and medical professionals who are properly licensed and properly having the guidelines in place to get the software. We have got doctors from Cleveland, we have got doctors from Harvard, we have got doctors from Johns Hopkins, we have got doctors from Boward Health, we have got doctors from Boston Clinic, we have got doctors from United Arab Emirates, the Emirati hospitals, we have got doctors from AIIMS, we have got doctors from other multi-speciality hospitals in India. And now, that's the end of my speech. If it was boring, I'm really sorry, but this was the most interesting thing that I could do, is that directly show you not the future of healthcare, because a lot of people are talking about the future. In 10 years, Indians' AI ecosystem is going to be this. But just a note, if you're thinking 10 years ahead, you're already slow, because 10 years is right now. So with that, I would just like to conclude what I'm saying and looking forward to collaborate with more and more hospitals and make West Bengal more healthy and make my mother India even more healthier. Thank you. Thank you. Thank you. Thank you.
Thank you, Vaibhav. It was really a pleasure, listening to you. I was, in fact, going across the stalls and I saw some of the taglines of your, banner, and I was really curious. And thank you for a wonderful presentation. And I would now request Ms. Dolly Beshash, Co-Chairperson, Health National Committee, the Bengal Chamber, and Chief Nursing Officer, Fortis Hospitals, Anandapur, to please present a token of our appreciation to Mr. Vaibhav Ram.
Thank you. Thank you. Thank you.